welcome everybody, to all the panelists, to this APEC CEO dialogue entitled The Economic Value of Modernizing Our Health Systems, Lessons Learned from COVID-19. I think it's fair to say that the world stands at a crossroads in the fight against COVID. We did hear some very encouraging developments this week. Still, we cannot say with certainty that we are turning the tide on this pandemic, since challenges remain on the approval front, logistical front, and also public acceptance of a vaccine. Still, this does mark something of a breakthrough moment, but governments around the world are mired in the present of the reality of a second wave. And then, of course, there is the longer term challenge of reforming healthcare systems, which themselves have come under enormous strain. So let's try to make sense of the way forward. And let me just introduce all the panelists. First of all, Marc-Antoine Lucchini, Senior Vice President and Head of International General Medicines at Sanofi. Garance Wattez-Richard, Head of AXA Emerging Customers at AXA. Professor Panos, Kanavos, PhD, Deputy Director at the London School of Economics, Health, and Deputy Secretary General Masamichi from the OECD. First of all, let me get your view on the progress towards a vaccine. Some are calling the results of the late-stage clinical trials by Pfizer and BioNTech a breakthrough. Moderna's results as well have been very encouraging. And Professor Panos, let me start with you, if I may. Is this a game changer? And could we be at a tipping point where we potentially break the back of this pandemic?
Thank you, Sri. I do think that a vaccine is a game changer. We've seen some extremely significant implications of the pandemic in terms of the macroeconomic environment. We've seen a significant contraction. We've seen a global recession. I think estimates from international organizations forecast a minus 4.9 or 5% recession this year, and this is likely to continue a little bit longer. I think if a vaccine proves safe and efficacious, as we all hope that it will, I think it will be a game changer. Although, of course, the effect is, in other words, the access to it by everyone, and the effects of that are going to be felt well into 2021. So from a macroeconomic perspective, if you will, I think we'll see a gradual impact of the vaccine. From a healthcare perspective, of course, I think if it is shown, or if all vaccines are shown to be safe and efficacious, then obviously we're going to see a significant improvement, and obviously a relaxation of whatever lockdowns we're experiencing currently in extensive parts of the world. So yes, I think the implications can be momentous from a healthcare perspective, but also from a macroeconomic perspective. We're probably going to witness a return to normality, although that normality is going to be gradual, not immediate.
And Masa, if I can turn to you just to elaborate on the economic picture in a post-COVID environment, and possibly in a vaccine environment. Is this going to be a game changer for the global economy if countries can end restrictions and reopen fully?
Thank you. Of course, we all hope that this will be a game changer and we have a strong recovery from next year. But I will just talk about our projections so far, and please bear with me with a bit of figures that we have here. But actually, of course, there's no doubt that this pandemic has really caused the worst recession since the 1930s, and we saw quarterly GDP declines of more than 10% in many countries during the confinement phase. And of course, there was a substantial weakening of labor market conditions. But then in September, we released an interim economic outlook, and we projected global GDP to fall by 4.5% this year before growing by 5% in 2021. And this is despite the rapid and massive action of policymakers in many countries to cushion the initial blow. And I think this cushion or buffering was to a certain extent successful. But then, and then we saw a rather swift recovery in the third quarter following the easing of some containment measures and initial reopening of businesses. But the worry is that the pace of recovery has lost some momentum more recently amid the renewed uncertainty. And so, well, of course, I can talk about our projections for this vaccine to become widely available. And we said last May that it could take at least 12 to 18 months for an effective vaccine to become widely available. And I think this is the important point, widely available, because, of course, you would want to vaccinate something like 50 to 75% of the global population, which is a huge challenge. And you have to build manufacturing and distribution capacity, make the vaccine affordable, and decide who gets access first. And of course, you have to plan for massive vaccination campaigns. And of course, many countries are now embarking on this, but we just have to expect that this will take some time. So coming back to the economic picture, I think we still have to expect those confinement or restrictive measures to stay in place for at least a substantial period, which means that economic activity, of course, will only gradually recover. And it's hard to speculate because there's so much uncertainty, but at the same time, at least it's a bit too early for euphoria.
A bit too early for euphoria, Masa. And let me just ask you then, is it way too early to even start considering upgrading economic forecasts, even for 2022, if we could see a meaningful change for the better and the tide turning in 2022?
Thank you. Well, for 2022, I think I'll have to have our chief economist publish our economic outlook due in December. But let's say our projections up to now have already incorporated this, let's say, development of a vaccine, and this vaccine to become available in, let's say, 12 to 18 months. So in that respect, we don't see a major let's say, upgrade or upscaling of our projections. But of course, you can prove me wrong if our health experts tell me otherwise.
All right, Masa, thank you for that. Garance, if I can turn to you now, how much confidence are these vaccine developments giving you from a business and a client confidence point of view? Does it signal a meaningful change as far as the business outlook is concerned?
Absolutely. Just because so far, I think, well, AXA, I'm speaking for AXA, but I think it's a reflection of, and Marc-Antoine, you'll correct me if I'm wrong, the reflection of all industries. We've all tried as much as we can to contribute to the coping strategy. I guess insurance has been in the front line along with financial services and hasn't had an easy time, just because it's hard for people to understand that the insurance industry cannot finance the whole of business interruption of the world. Because if we did that, then all of our people who've saved money with us and who have life insurance would lose everything because we would put the key under the door. So by definition, we are one of the industries that's the most our clients are expecting a lot from the vaccine because we've done a lot with the coping strategy, as I was saying, by injecting capital in companies, by moving back premiums, by extending coverage, etc. But if there isn't an exit strategy, which is the vaccine, then we'll never be able to move forward and understand how we can better protect business interruption, how we can have an open dialogue with governments to establish a sort of a public-private sector approach to pandemic risk, kind of like cat-nat, because we can't carry that alone. And I think a lot of our clients, a lot of our investors, a lot of our analysts are waiting for that. Now, where we're very wary is that we don't count on it, in the sense that insurers are the risk managers of the world. So what we say is we need to continue to invest in treatment. We need to continue to invest in prevention, in social distancing, in everything we can. Let's not 100% count on the vaccine, although this is maybe a slightly risk averse. Once we have the vaccine, we have learned our lesson, I believe, and we have prepared in advance to next time it hits, because what we are seeing, again, maybe I'm a pessimist from the insurance industry, what we have seen is that this is not going to be the last pandemic. This is not going to be the last huge systemic risk that hits us that we've never seen before. And hopefully next time, I think the private sector and its clients will better understand how to establish a dialogue that maybe was a bit confusing this time around.
Yes, and this entire pandemic, this entire public health crisis ought to be a major wake-up call for reform of healthcare systems in developed and developing countries. We'll have to see if there is the political will to pursue that. Garance, just on a consumer level, we know that Asia as a region is underinsured with health insurance policies, as I understand it, and also life insurance. I'm just wondering, in terms of the numbers, whether this pandemic has been a wake-up call for consumers to change that, to shift their attitude. Has that changed when you consider the volumes?
The whole world is underinsured. If I told you the penetration rates country by country, I don't think you would believe me. Then again, the indicator of penetration rates in insurance is a complicated one because the denominator is GDP. So it's premiums to GDP, which is always the most ideal one. But still, you would be surprised in Asia, in Latin America, it's 1 to 2% of the population. It's 1 to 2% of penetration rates. So has this changed something? Of course, because, and I was going to talk about this a bit later on, and I love the fact that you've inversed everything because it makes it more dynamic, but this crisis is a silver lining. And one of the silver linings is that it's given the entire world, it's like we all took a MOOC together, a crash course on health and life. And so the real silver lining is that it's given us a crash course on preparedness. And what does that mean? That means thinking ahead. And all of our clients, whatever their social economic status, whether they're retail or commercial, have started looking ahead and better understanding what their health is like, what their family's health is like, what their employees' health is like, and are they better covered? Significantly. This has also gone through digitalization. Because as you know, or no, I hope you don't know, because not everyone should spend their weekends being fluent in insurance. But one of the problems of our industry is that it's pay now and let's see later. So people have a hard time touching the value, right, of insurance. And during a crisis, it's hard to say I'm going to spend money on something that may not happen again, right? So what we've gone through is things like telemedicine, teleconsultation, I know in collaboration with companies such as Sanofi. Once we get the trust so that they understand that that the industry, the private sector is there to bring value and to be a partner, that's where insurance has stepped in. It has come with clients understanding, consumers, patients, understanding that it goes together with a dialogue. They're all worried that if they already have an illness, then there's no way to help them. That's actually not true. there are several ways to help them. So in the short answer, sorry, that was a bit long, but I am French. The short answer is yes, it's had an impact. And for us also, because we understand it better also how to protect our clients.
Garance, thank you very much indeed for that. And it's a very emphatic point there about the importance of long-term planning. And I think the big takeaway from what you said is, look, let's not be complacent here. This crisis could arise again, and we've got to better stress test everything from a consumer point of view and from a health and from an official government healthcare systems point of view. Marc-Antoine, let me get to you. And the financial markets clearly believe that this is something of a breakthrough moment as far as the vaccine is concerned. But specifically, what would you say are the scientific, logistic, and commercial challenges that need to be overcome before we really see commercial availability of this vaccine?
Well, thanks for the question. I think first I just wanted to emphasize, of course, that we are thrilled by the news of this progress that Pfizer has announced this week. And I think it shows you also, and it's very crucial to understand that we are not in the race against the competition, but in the race against the virus. As an example, of course, of the fact that not one company or one technology can address this problem. As you know, we are partnering with another company, GlaxoSmithKline on the collaboration to find also a vaccine. And it shows you that when the two major companies in vaccine development are getting along. And just as an anecdote, we find the agreement, or we signed the agreement with Glaxo in 12 days, which shows you also how keen and how reactive the industry has been, of course, to address this major issue. So I think that's indeed a very, very positive point from a scientific standpoint, because it's building, of course, starting to build the evidence. And of course, we have to look at the data and look at the evidence. But I think what we're hearing is showing a very, very positive development that will also be supporting our effort on another development that we have on another platform. So that's an important comment or message that I wanted to send. Now you address.
If I may, can you just bring us up to speed quickly in terms of where you stand with that vaccine development with GSK?
Well, I think we have communicated recently the fact that we will be starting our major phase 3 trials hopefully by the end of the year, and what we will be seeking, of course, as we are developing or running those last development trials, will be in parallel, of course, seeking and working with the authorities to share the data in order to accelerate as much as we can the approval. And an important point also to show you the commitment and also somehow the risk that companies are taking. We will be producing, of course, major volumes of vaccines, not to wait until the approval of our vaccine that hopefully will be achieved by mid-2021. And at that stage, we believe we'll have already a large capacity volume being produced to make sure that we don't wait a couple of months to be able then to provide this vaccine to the populations and to the governments who are in need of. So most likely mid-year in terms of regulatory approval and having a substantial quantity and volume to be distributed.
That's very encouraging. And Marc-Antoine, would this be dosages that would be directed towards the European market, or would they be made available globally? Because the reason I ask it really points towards a broader question. China is developing its own vaccine, although there has been one reported fatality during the trials. Russia is developing its own vaccine. And I'll put this question to Professor Panos as well. But Marc-Antoine, do you feel that there should be better global coordination of these disparate, though very positive, vaccine efforts?
So let me answer quickly to that question, and I think it's a fundamental question. So you mentioned Europe. Of course, it's not because we are a European company that we're going to focus only on Europe. The way usually, and of course, vaccines are being distributed is through a financial support system. We call those advanced purchase agreements, and usually those agreements are phased over time. And of course, they are activated when the milestone results are achieved along the way. So we have indeed an agreement with the European Union, but we have also some advanced purchase agreements made with some other countries, the US and other countries. I think what I would like to emphasize also is that in that specific case, the international public health community has come together to organize what we call a global pooled procurement mechanism called the COVAX facility. And that facility is led by WHO, Gavi, and other associations. And I think it's very essential because it will facilitate access to any and all the countries participating to this COVAX platform in an efficient and ethical way, regardless of development status. And we believe in Sanofi that it's, of course, not our role to choose, but I think this platform will be indeed, we believe, the best way to make sure that the vaccine is distributed in an equitable and fair way. So I think for me that's essential. And just I would like to emphasize also from a Sanofi perspective, of course, that we are also considering many different manufacturing options to make sure that we have the full capacity to respond, of course, to the worldwide demand. And in that respect, we are also preparing for tech transfer and collaborations to make sure that we can develop as much volume that is needed in an affordable way.
So Marc-Antoine, if I may, does that imply that you are open to working with generics to scale up?
Well, I think we're looking at many options, and of course, when you say generics, I'm sure you refer to the capabilities that we can find in other parts of the world, and I think we are very open to look at opportunities, of course, and I think it will depend also highly, on the number of vaccines actually who reach, of course, the approval, and I think it's very important to keep this in mind that no one, and I think I'm speaking on behalf, of course, of our partnership with GSK and Sanofi, we will not compromise also on safety and on the quality of the development. So we'll have to look, next year how many vaccines have reached the approval stage from the authorities, and at that stage, the volume that will be needed will be getting clearer.
Marc-Antoine, thank you very much indeed for that. Professor Kanavos, I want to get to you, but before I do so, Massa has a point that he would like to make. Go ahead, Massa.
Yes. Thank you for my two-hander, but I just wanted to mention that at the OECD, we have been calling on governments to do the best they can, and of course in accelerating authorization, etc. But we were calling for not just those push mechanisms, as they may be called, such as research grants, but also pull mechanisms and the international advanced market commitments may be one form of this pull mechanism that we really want to encourage. And of course, there is already the COVAX AMC that was that Marc-Antoine just mentioned. I think this is an encouraging development, but there's more to do, and the international cooperation certainly essential, but there's also a need to address the issue of intellectual property rights and procurement. So just wanted to interject on that. Thank you.
Thank you very much indeed for that perspective, Massa. Professor Kanavos, if I can get to you, then I'll get to Garance, who has her hand up. Professor Kanavos, we heard from Marc-Antoine about the COVAX facility. How much confidence and faith do you have that this global system will ensure that the rollout of the COVID vaccine, whoever the developer is done on an equitable, inclusive, and affordable level?
Well, all these are fairly aspirational, I would say, but there's a practical aspect to it. And I think Marc-Antoine mentioned the practical aspect, which is really that the the product is affordable. And I think we're looking at an equitable distribution and affordable, obviously distribution. I think some of the actors, a number of the actors, have been involved in vaccine procurement from a global perspective anyway for a long time. And if you look at Gavi, for example, or in Latin America, if you look at the at PAHO and the way it coordinates activities of vaccine purchasing, negotiation and purchasing on behalf of its members and more widely, I think we have mechanisms effectively that would ensure that there is that kind of equitable distribution, and obviously it has to be affordable. We're looking at a pandemic here. And I do believe that when we're looking at a product that addresses the consequences of the pandemic, which are fundamental not only from a healthcare system, but also from a macroeconomic perspective, we're looking really at a global public good or a range of global public goods. And effectively, we have to, all stakeholders, whether it is government or industry or insurance or healthcare system or whatever, I think we have to come together on that front and effectively ensure that, let's say, some of the OECD countries, let's say, whether they are in North America, Asia, or Europe, have similar or the same access to it as some of the APEC economies in, for example, Indonesia or what have you, but also in other parts of the world, in sub-Saharan Africa, where there's also a great need. So my perspective here is that we're looking at a global public good. The actors need to come together, whether they are governments, international organizations, or in fact donors who have actually been very good with the facilities that they've made available and the monies they've pledged to ensure that distribution in the emerging world, or in fact the less developed world. So I think that's an important factor to consider.
Garance, you wanted to make a point.
It's great because it just follows what Professor Kanavos said. Again, I'm going to go back to my silver lining. The silver lining here is, I think, that it will teach us the distribution of this vaccine, and I have to say at AXA we've been very impressed by Sanofi's approach to this, is that we will learn for other vaccines. And we are currently putting together, driven by the Lloyd's syndicates, but many other insurers, a group that's looking to ensure the distribution of the vaccine. As you can imagine, this already exists. It's not like distribution of the vaccine didn't have a form of insurance, but the risk landscape of this vaccine is quite different. One, as we know, the majority of vaccination campaigns was infant vaccination. So the distribution in country from the airport to the arm, the distribution channels are going to need to be different and multiplied by hundreds. Two, we don't know, but the temperature at which this particular vaccine will need to travel is not going to be the same. Three, there's an extra risk of theft by definition, which other vaccines, few people look to steal BCG vaccines. Four, what we don't know usually is that there is a lot of product that's usually lost along the way of any vaccine. If you look at the WHO website, it says that between 30 and 50% of product is lost along the way because there's a fire, because there's a flood, because there's a spill, because from the bulk to the fill and finish, there's product lost, etc. And Marc-Antoine can give you more numbers than I can, but if I understand correctly, it's so much more expensive for a pharma to develop a vaccine than it is to produce the product, that in a way it's not that big a deal to lose, your average vaccine product here, because we're looking to vaccinate 7 billion people. It's a big deal. So the risk landscape is not the same. We have to look at it more closely, where many insurers getting together to not only reinsure, insure, risk manage. Are the warehouses in the right place? Do they have a sprinkler in the right place? Do we have the sensors in the boxes that will tell you it's gone from -80 to -70, and so it doesn't work anymore? Does everyone have an ID? This is a silver lining. This COVID crisis if underlying trends that in the defense of the public and private sectors have already started on digitalization, etc. But look at the ID problem. We have X% and mostly women, by the way, in the emerging world that do not have an ID. If they don't have an ID and they get vaccinated, we don't know when they were vaccinated. We don't know with what batch they were vaccinated. So maybe this COVID crisis is also going to push us to solve some problems more quickly than we would have if it hadn't come about. Maybe this is also a way of transporting better a lot of other health products that will need treatments for another pandemic, for this pandemic. Identification, as I said, is another one. The role of women in healthcare, the role of women in the health equation, universal healthcare that's needed everywhere. And I think following the global crash course that people took on health, I'm sure there are no more doubtfuls, and I hope Professor Kanavos is happy about that, because I'm sure he's a pro universal healthcare everywhere advocate, as he said the other day. So just to go back to the vaccine, to your question, there is a risk element, and the private sector and public sectors are working together on that.
Yes. Fascinating what you said, Garance. Enormous implications for the insurance industry and risk management. But I thought that you enumerated the logistical challenges very starkly there. And as we know, this is not just a battle, this is a war against the virus, and logistics, as we know, and when we look through history, can either win or lose a war. So it's absolutely critical to get it right, and a public-private partnership is critical there. The more fundamental issue is reform of the healthcare system. And Professor, can I turn to you again? Because broadly, healthcare capacity has been sorely tested from developed to less developed countries. They've struggled to cope. Even the West has been overwhelmed. Is this because this has been a once-in-a-generation pandemic? And why in the 21st century is healthcare, which is so fundamental to a country's basic infrastructure, is this an area that's been neglected, underserved, underfunded, understaffed, and getting back to this issue of cost, unaffordable for many?
Well, we need to bear in mind, Sri, that prior to the COVID pandemic, a number of governments, in fact, many governments, were actually, in real terms, were either cutting back on health spending or keeping health spending stable, and whilst managing chronic disease. And I think what the pandemic has highlighted the focus and the need that we have, which is slightly underserved, if you will, in acute hospitalization. So we did experience, and we have experienced, and I think in some settings with the second wave of the pandemic, we are experiencing shortages in ICU capacity, for example. But obviously, between the first and the second wave that we're experiencing currently in many parts of the world, I think the way we're addressing that gap, that need, is better now compared to what we saw about 5 or 6 months ago. First of all, the pandemic has highlighted something very important in my mind, and that is a beacon for the future. And that important thing was that health security is crucial, not only for people's health and well-being, but obviously is a catalyst for the return of the economy to normality. So the healthcare system, therefore, needs to be strengthened. And I think that is something that will be, if you will, the legacy of what we have seen from this pandemic going forward. So I foresee in that context greater investment. I think in extensive parts of the world, we've seen that the trust in the healthcare system has increased quite considerably. As we see the system, the responsiveness, the effort, and particularly the effort by our colleagues, our healthcare professionals, all healthcare professionals, to address the needs that this has posed on society. But I do foresee fundamental changes in the way that the system responds to crises, that the system, for example, healthcare systems, around the world are looking at repurposing and becoming a lot more flexible in the allocation of resources, so that we can actually shift and switch where the needs are going to be in the future. So if we have a huge, let's say, surge in demand for healthcare services in one part of the healthcare system, then we can actually have the mechanisms to do so going forward. And I think that's an important consideration going forward. I think we may witness significant changes in the way our hospitals work in practice. And we've seen that in the 1990s and the early noughties with alternative mechanisms to hospital care. But going forward and in the future, it is more likely than not that we will see a significant difference in the way hospitals operate. For example, only for patients that do need hospital care, whilst all other cases are going to be treated, let's say, in the community, in alternatives to hospital care, and so on and so forth. That obviously happens in circumstances and situations where countries do have a well-established healthcare system. But the pandemic has also highlighted that the efforts towards universal health insurance coverage, and I'm glad that Garance mentioned that earlier on, is going to be fundamental for many countries. I mean, countries in the and economies in the region, the APEC region, have pledged completing universal health insurance or aspiring to complete universal health insurance. Obviously, this is a long-term journey and a huge investment on behalf of those economies' citizens. Nevertheless, I think the pandemic has highlighted the need to accelerate on that front. So I expect to see a lot more on this front, strengthening the healthcare system, investing in human resources, particularly healthcare professionals, but also other infrastructure. And what was mentioned earlier on, I wanted to pick that up as well, is the increased focus and the strengthening on virtual healthcare, which is actually, if you look at it historically, has actually struggled for many years to acquire the importance that it should have nowadays. Whether it is where we're talking about telemedicine or telehealth and so on. So I expect to see a significant, let's say, shift towards digital and digitalized health services across the region we're talking about, but more globally. And I think this highlights a need here from the healthcare systems to become more effective, to become more efficient, to become more flexible in the delivery of healthcare services, and more focused, perhaps, where the real need is, whether this is through patient segmentation or identification or risk identification, for example, or through other mechanisms. So I think there's going to be a lot of change that we are likely going to see soon, and perhaps sooner than originally envisaged. There was a survey not so long ago, a few months ago, that suggested that the healthcare policy implications of COVID-19 are not going to be the ones that I described literally a few seconds ago, but they're going to be brought forward by at least 2 or 3 years. So it's an acceleration on that front as well.
Professor Kanavos, thank you very much indeed for that. Marc-Antoine, there were a number of points raised there from Professor Kanavos, and I'm really interested in pursuing the telemedicine part of the equation, digital services. Can you give me a sense of where Sanofi stands in this journey? What are you doing on that front? Because it can really benefit, as I see it, the diagnostic side of healthcare, and it can also relieve the pressures, if you will, on the healthcare system if patients are able to go online to be treated or diagnosed.
Yeah, so sorry, very, very much in line with what has been said before. I think, first in general, how do we move to consider healthcare as an investment and not a cost? And I think that's a very important overall statement that I think we need all to consider, that once the crisis will be behind us, we need to fortify and reconfigure our healthcare systems, and I always give an example because I've been working many years on diabetes. When we look what we call diabetes pandemic, with 450 million patients worldwide, how do we tackle also those chronic disease with the same sense of urgency and mobilization than we are doing now for acute challenges. And therefore, what you're saying here on digital and moving to the digital opportunities for me is certainly and is a necessary answer, you know. And we see, of course, the change, as it was highlighted by Professor Panos, the change also on acceptance of telemedicine. We have some data in Sanofi where we see a shift in terms of acceptance, not only from healthcare professionals, but also from patients, you know. And let's remember that a diabetes patient lives 24/7 with its disease, while today in the current configuration of the healthcare system, you know, it will be accessing face-to-face to medical experts, maybe 10 hours per year max. So I think that gap needs to be addressed. And I think it's a fantastic opportunity to accelerate. We have also, of course, the key question of harmonized use of electronic health record, because we have seen during the pandemic how the data is of strategic importance. And it's how do we have this data up front, you know, in the context of a pandemic, but also in the context of chronic disease management. And I think the conclusion, of course, is the more we'll be able to connect and to have all these data being accessible, the better will be. So Sanofi, of course, is highly involved into that. You know, we are looking at ways. I mean, first, our interactions with healthcare professionals have been virtual for the last 8 months. And I think we have been able to run clinical trials. We have been able to continue to communicate, you know, have exchange on medical education. So I think we're showing that it's possible, and definitely for us, you know, we are looking at the post-crisis as a different universe in which we need to continue to develop and enhance those digital partnerships, you know.
Yes.
How do we also bring tools, elements that will allow, for example, to the doctor who is in a consultation, a virtual consultation with his patient, to provide to the patient the need education, for example, for a change of therapy, for an initiation on an insulin. Those are very important questions, because we see, of course, that in these last months, it was a little bit more difficult for a physician to change a therapy, to engage or convince a patient to move to a new treatment. Yeah. And I think we have to adapt also the tools and the education platforms to make sure that we are supporting our physicians into these critical changes.
Absolutely. A lot of these pre-existing conditions are rife in Asia because of the demographics. And arguably, COVID has aggravated the strain on the health service because of that. Professor Kanavos, I wanted to return to you. You had your hand up, and then we'll get to Garance. And then I think we are going to have to wrap things up. Professor, go ahead, please.
No, I just wanted to highlight one word, which I think Marc-Antoine mentioned earlier on, but I think we need to keep it as a beacon for our future discussion. Is that namely that investment in health produces wealth. It's the argument of health is wealth, and we see that right now. We are effectively experiencing the consequences of restrictions, of lockdowns, and so on, which have fundamental implications on our economies. And obviously, investing in health, and one way of looking at it is to effectively have an effective vaccine in this particular context, is going to return us to normality fairly soon. But more generally, the argument is and should be and has been that investment in health is actually producing wealth.
Point taken, and the vaccine is just one piece of a broader mosaic. Garance, go ahead, please.
So very quickly, because I know we're out of time, I just wanted, if you had asked me what were the 2 things that I really wanted us to remember beyond all of the, you know, very important facts that were mentioned today, is one, and it concerns a lot the APEC countries, I believe, is that we need to not forget the middle children, which is the people that are too rich to be poor and too poor to be rich, therefore are not covered by public health systems or mandatory insurance from the government, but are not rich enough to buy private insurance, to go to private hospitals, etc., etc. And that's really very important because we do have a tendency of forgetting them, and they represent 80% of any given population. They're, to give concrete examples, they're construction workers, nurses, teachers, people in shops, etc., etc. And to the professor's point, it needs to be affordable, it needs to be accessible. And today they're stuck in the middle. Even if I listen to what was being said on the COVAX accelerator by Marc-Antoine and on the AMC process, Gavi, today there are 65 Gavi countries. There are about 30 Gavi graduates. There are about 30 very rich nations. What about the middle children? In the middle, they're not covered by Gavi. They have Latin America is covered, as Panos said, with their specific mechanism. But there are a lot of countries in the middle and a lot of populations in the middle. That's one point. The second, and usually in families, it's the middle child that suffers the most. If that's easier to remember. And then my second point is about mental well-being. I think that the crisis has very much put the finger on the fragility of our mental state. That confinement has put the finger on that, of women, etc., in confinement. So, and I know Sanofi is looking at this closely, but AXA is also looking at this very closely because we need to make sure that the mental well-being of our patients is taken care of, and we have a tendency of forgetting it because you can't see it. And digital, to your point, telemedicine, everything linked to video is very adaptable to helping on mental well-being. And it's not only about the rich people and the big companies needing to be supported from a mental point of view, or I don't mean mental, but I mean psychological point of view. But it's also that if you're a nurse or a school teacher and you're the middle class, then it's not a luxury to be worried about your mental well-being, of course, chronic disease, etc. But I just wanted to emphasize that point. Thank you.
Garance, thank you very much indeed for that. I know that we're running over, and the moderators will be, organisers rather, will be scolding me for this one. But I did want to give the final words to Massa, if I may. And Massa, on this issue of affordability, it's interesting because on Sunday we could see the signing of the RCEP, the Regional Comprehensive Economic Partnership. This is a major trade deal. About a third of global economic activity represented. And I'm just wondering if it does ultimately bring down the barriers to trade, is it going to bring down prices as well? Is it going to make healthcare and pharmaceuticals perhaps more affordable for people in this region?
Yes, thank you. Well, actually, almost everything has been said in terms of what I was going to say on going digital. But, well, on this trade and investment issue, open trade and investment certainly helps. And also, we already have some evidence, actually, that global supply chains for healthcare goods and other needed equipment has actually functioned well in this crisis. And we will really want to avoid having unilateral protectionist measures to be added to the current already somewhat difficult international trade and investment environment. So we'll be working on that.
Massa, thank you very much indeed for that. Well, that brings us. I want to turn to Minister Chen now, who's going to say a few words about the importance and value of the modernization of healthcare systems. And Minister Chen, if you could walk us through your experience at Chinese Taipei and the challenges in a COVID era and the journey forward.
Distinguished guests, ladies and gentlemen, hello. I deeply appreciate APEC and Sanofi's invitation to participate in today's discussion. Due to a scheduling conflict, I will be participating via a pre-recorded video. Chinese Taipei has managed to minimize the impact of the COVID-19 pandemic. As of November 10th, we had a total of 580 confirmed cases and 7 deaths. The number of confirmed cases ranks 163rd out of 185 economies, and there have been no locally transmitted cases for 213 days. China Taipei has achieved a balance between preventing the spread of pandemic, maintaining people's daily lives, consumptions, and production. Our economic growth rate for the third quarter of this year was 3.33%, making us one of the few economies in the world with positive growth in these trying times. Moreover, Bloomberg ranked our overall performance of pandemic prevention and control first in the world. Our response to COVID-19, Chinese Taipei has followed the 4 principles of prudence, rapid response, advanced deployment, and transparency. Our success has been due to a number of epidemic prevention and control measures. Firstly, we established a central epidemic command center, which provided real-time epidemic information during daily press conferences. Secondly, we use digital technologies to establish an electronic entry quarantine system, an electronic fence system, and line board. Thirdly, by using our universal health insurance system, which has a coverage rate of over 99%, we implemented a name-based system for ensure the equitable distribution of face masks. We also employed the National Health Insurance MediCloud system to identify patient travel history to assist physicians detect possible cases early. If you would like more information, we have set up a website entitled Crucial Policies for Combating COVID-19. The website includes key policies and experiences, and we are happy to share it with all economies. At the onset of COVID-19, the government and the private sectors quickly began collaborating. A national face mask team was formed, and the face mask supply chain was established, allowing us to increase the daily production of masks from 1.88 million in January to 20 million today. We have also established a national drug research and development team to strengthen cooperation between the public and the private sectors, as well as actively assisting local vaccine manufacturers. Due to Chinese Taipei's high vaccination coverage rate, roughly 90%, I'm confident that COVID-19 will be eradicated here soon after the vaccine is made available. From an economic standpoint, the COVID-19 pandemic has deepened the risk of supply chain disruption, which has prompted the division of labor in global supply chain to move toward a regional short chain model. In particular, digital technologies and precision medicine will bring unprecedented transformation to the biomedical industry. Chinese Taipei has a world-renowned medical system and excellent information technology infrastructure. We are willing to work with member economies to promote global and regional digital health and achieve the goals of sustainable development. Thank you for your attention. I wish you all the best of health, and may this year's APEC CEO Dialogues enjoy great success.
Dr. Rohaizat, if I can bring you in now, and also just give us a sense of the importance and the value of the modernization of healthcare systems, the experience in Malaysia, and the challenges you faced in a COVID era and beyond.
Modernization of healthcare system is an ongoing process. Modernization theory suggests that traditional societies will develop as they adopt more modern practices. Even adapting new norm is a process of modernization as well. And from healthcare perspective, we manage to work beyond normal. We manage to work beyond traditional norm by expediting procurement processes and also strong inter-agencies collaboration and putting public health interests first. And most of the time, we expect new health interventions are more effective and safer compared to the current treatment. However, in many cases, these technologies lead to proliferations of new services without replacing the existing services and becoming additive rather than substitutive to the currently available health intervention. This will incur additional costs to the healthcare system. There are also new health interventions which may appear very costly at forefront, but can be cost-effective in the long run. Thus, proper evaluation of the values of this health intervention is very, very important. Value-based care, which take into account the best available evidence, patient values, and the resources expended, is a holistic approach of policy and decision-making in healthcare. By adopting this concept, information sharing could be widened between all healthcare sectors to maximize benefit both to patients and to society as a whole. Therefore, health technology assessment, HTA, including its horizon scanning activity, is one of the systematic process that takes into account value-based concept in providing information to the stakeholders about new and emerging technologies and innovation in healthcare that have the highest potential for impact on clinical care, impact on the healthcare system, patient outcomes, and costs. The government of Malaysia is recently announced budget for 2021 has stated that the budget is focused on public well-being and among others, RM 19 million ringgit Malaysia, 19 million for Healthy Malaysia agenda. I repeat, ringgit Malaysia 19 million for the Healthy Malaysia agenda, and also ringgit Malaysia 90 million for pneumococcal vaccination, and ringgit Malaysia 24 million for mental health. And this year, next year, 2021, will be I think the biggest budget ever so far that been given to the Ministry of Health. This is an investment for well-being of the population.
Dr. Rohaizat, thank you very much indeed for that. So despite the truly encouraging developments that we heard about the vaccine, how this potentially could be a breakthrough, there are still fundamental issues that remain about the healthcare system, not just in developed countries, but in the developing world as well. A lot of work needs to be done in terms of reform, and also affordability of healthcare remains a particularly challenging issue. With that, we bring an end to this APEC CEO dialogue, the economic value of modernizing our health systems, lessons learned from COVID-19. Thank you for watching.